So in all of my years of practicing, I would say that beauty has changed for me. When I first started, I thought it was like the proper, the perfect skin, the perfect lips, the perfect cheeks, the perfect jawline structure. And now I really think that beauty has a deeper meaning in the sense of like where you feel most confident and most yourself.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Roni Bolton, a nationally recognized laser specialist, aesthetic nurse, and founder of Precise Aesthetics and Precise Cares, a nonprofit dedicated to transforming lives through laser tattoo removal for survivors of trafficking, ex-gang members, and individuals re-entering society. As a clinical leader with Cervelo, Roni has helped shape the next generation of laser technology and education, setting new standards for efficacy and safety across all skin tones. Known as a pioneer in laser dermatology, she's redefining what's possible in skin health by centering lasers as the gold standard for treating complex skin conditions. With years of hands-on experience, she's trained and mentored countless providers, combining science, artistry, and compassion in every aspect of her work. Whether she's behind the laser or behind the mic, Nurse Roni is leading a movement where innovation meets impact. So Roni, welcome and glad to have you here.
Thank you so much for having me. I appreciate it, Daniel.
Yeah, so Roni, let's start with this. How did you first get interested in the medical field?
Absolutely. So I actually worked in business development in a plastic surgery office. The doctor there was like, "Hey, Ronnie, you're taking quite an interest in our procedures. I think you should like think about going back to school." And I was like, "There's no way I'm going back to school. Like I have an MBA. This is not happening." But then after further thought and having conversations with my family, I decided, you know what, there's no time like now. Decided to go back. And I haven't looked back since. I've been working in plastic surgery and dermatology since then. So it's been an amazing journey that I couldn't even have even imagined.
Mhm. So you started off in aesthetics already with plastic surgery.
I did,
Oh wow.
yeah.
Okay. So you just
I was just
you
on the business development side of everything.
okay, got it.
Yeah.
So what led you to want to start your own practice? I mean, why not just keep working for the other practices?
Absolutely. So, what I really found is that I wasn't able to kind of have my own voice and my own culture and kind of practice medicine in the way that I found to be appropriate, right? For all skin types. It was very much so like a very cookie cutter type of background, and I just didn't want that for myself or my future. So I'm kind of like, a misfit when it comes to like laser dermatology, where I kind of push the parameters and the boundaries of what's supposed to be done. And so doing that has kind of made me garner different protocols and become quite a leader in the industry to be able to make these like radical transformations with skin.
Okay. And so now that you have your practice, I want to dive a little bit deeper into the treatments that you provide.
Yeah.
Let's start with the tattoo removal, because that was one
Yeah.
thing that you do for survivors, people re-entering society. So you talk a little bit more about that.
Yeah, absolutely. So I've been doing laser tattoo removal for about 13 years now. It is our top service here at PSRX Body and Skin. What happened and why I started my non-for-profit Precise Cares is that we had a lot of inquiries of people who were coming back into society or not able to get jobs with
Mhm.
tattoos on their face, their neck, I mean, teardrops, all types of things that were just basically blocking them from being able to re-enter. And, lasers are expensive, laser treatments are expensive. And so I was always kind of turning away these people who really needed my help. And at a certain point, I just had to kind of take that responsibility on for my community and just say, you know what, we have to figure out a way to give back, to be able to make sure that we're using our technology and our skill set for something greater than ourselves and for business.
Okay. So when it comes to the tattoo removal itself, could you talk a little bit more about that for people who just don't know what goes into the process. I mean,
Yeah,
I've heard a
absolutely.
little bit of it, but I think it's kind of like you're kind of trying to break up the ink somehow. But could you kind of dive
Yeah,
deeper into it?
yeah. So I explain this every day. So it's really easy for me to kind of break it down.
Hmm.
So basically, we use a Pico laser, which works with photoacoustics.
Hmm.
The laser hits your ink, breaks it down into small enough particles for your white blood cells to then carry that through your lymphatic system. So when you first got your tattoo, your body recognized that ink as foreign and started to try to attack it. Just it's not
Hmm.
strong enough, and the particles are too large.
Hmm.
So the laser assists us in breaking that down small enough so that your white blood cells can then actually take it out through pee, poop, and sweat. And that's how you get rid of ink. It's
Oh,
really a cool
interesting.
process.
Yeah.
It's a very it's a process that you have to be very patient with. It takes between 8 to 13 sessions for complete removal, and it can take more or it can take less. I've had as many as 27 treatments for a complete removal and as little as two, right? So
Mm.
it's just a matter of kind of like what kind of ink was used, how was it placed, how deep did they go into the dermis, what color is it, what color is the skin type that you're treating on. And so there's so many different parameters that go along with how long it's going to take for that to be removed.
Okay. And is size a big factor into it, or does it not really
Um,
matter the size?
that is actually a misnomer. So we get a lot of phone calls where people are like, my tattoo's only a dot. And it
Mm.
really doesn't matter because if the dot is super deep into your dermis, it's going to take me just as
Mm.
long to remove that as if it was a full sleeve. So really, the size doesn't really matter. It's only a matter of kind of like pricing where that makes a difference.
Okay.
Yeah.
And as far as you mentioned that it could be anywhere from 2 sessions to 27 sessions,
Yeah.
how much time do you have to wait in between these sessions?
Yeah, so my patients are required to wait 8 weeks. And the
Mm.
reason being is that you only have so many white blood cells in the area that we're treating. I have no reason to treat you any sooner because if I do, I'm doing a disservice to your service. So what ends up happening is if I treat you sooner, the laser is essentially sorry, I can't even talk. The laser is essentially hitting ink that it already hit.
Mm.
So we have
Okay.
you come in every 8 weeks just to make sure. And then once that tattoo starts to fade out, I push out those treatments even further. So we're like
Mm.
8, 10, 12. And then once we get to the end where it's super faded, I might even say 6 months. It just kind of depends on where we are.
Okay. So the entire process could potentially take years.
Years. Yeah.
Okay.
Yeah.
And
Our laser tattoo removal patients really become family because
uh
I'm at least seeing them at least for 2 years. So,
yeah. Okay. And so throughout this process, um, I'm sure you get this question a lot. Is it painful?
yeah, it's a laser. You know, for me, I'm always like pain is subjective, and it kind of how somebody tolerates laser tattoo removal is kind of dependent upon how you receive pain.
Mm.
But I will say that working with newer technology, it's a lot more comfortable for my patients. Older technology, nano, Q switch, people even using IPL to remove tattoos, you're going to experience a lot more pain with that.
Mm.
Pico lasers work primarily with photoacoustics and then a little bit of heat. So it's about 20% heat, and the rest of it is that friction of the laser that's breaking that up. So it's a lot less painful than older technology, but everything comes with a little, what I call it a little spice.
Mhm.
Um, because it's a laser. It's just
Yeah.
is what it is, you know?
Okay.
Yeah.
So, and if people go through the entire process, do you completely remove the tattoo, or does it just get to a point where it's just so faded that people can't really tell?
No,
But
we pride ourselves in complete removals in this
wow.
office. Yeah.
Okay.
So we
Okay.
do have people who give up in the process, right? Like there's
Mm.
going to be a point in time. Sometimes a patient is just going to say, you know what, it's faded enough. And
Yeah.
then that's our after, right? Like we
Yeah.
can't force a patient to be treated.
Mm.
But if they are willing to go the whole route to have a complete removal, we definitely can achieve it for them.
Okay. Got it. Now, I want to switch over to laser dermatology. And
Yes.
what is laser dermatology, that concept?
Absolutely. So, laser dermatology is the practice of dermatology with energy-based devices.
Mm.
So, treating all type of different skin disorders, but using energy-based devices to be able to get that patient a clinical result.
Okay. And so when it comes to these different devices, are these devices going to fit to a specific type of condition like acne or I guess or like whatever, I don't know, maybe the different skin
Yeah.
like conditions, but like, is it going to be specific to a skin condition or a skin type? Like if you're lighter or darker skin, like what's kind of differentiating factors between what treatment you use?
And the answer to that is both.
Hmm.
So there are lasers that are specifically dedicated to treating a certain type of skin condition. However, sometimes that laser doesn't necessarily fit that skin type, right? Or skin color. So we kind of have to understand, laser physics and those protocols to be able to know exactly which technology can be used on which skin types.
Ah, okay. And so when it comes to the dermatology, is it pretty much, have you found that laser can fix just about most skin conditions?
Yes.
Okay.
So a big reason why our clinics went from your traditional med spa to being a laser dermatology center was because there were so many different skin conditions that other practices weren't really taking the responsibility to treat.
Hmm.
Number one that we get in our office is always hyperpigmentation, people wanting even skin tones. So when I say hyperpigmentation, I'm speaking of all pigmentation disorders, whether that's melasma, just post-inflammatory hyperpigmentation, or you're dealing with some form of like rosacea, sunspots, sun damage. That's number one in our practice. So literally having just a traditional med spa wouldn't enable us to be able to treat the most common condition that people are always asking about.
Hmm.
And so it really made me kind of pivot our practice and kind of focus on those particular things that people see. When you think of anti-aging, wrinkles, sagging skin, laser. Obviously, we have our CO2s and our erbium lasers that help with resurfacing and being able to tighten skin as well. We have energy-based devices like microcoring, removing pieces of skin so that new cells rejuvenate and then tighten skin up. So there's so much that lasers can treat that it's kind of every other service that we do, dermal fillers, chemical peels, facials, all that stuff has become a support to what we use in energy-based devices.
Okay. And how do you account for people who have sensitive skin? Is it kind of the same thing that it just depends on the laser? Some laser good for sensitive skin or not? Or is the laser going to be the same for someone that has regular skin or sensitive skin, but if you do something more for the sensitive skin people?
So it's not that they can't use that you can't use laser technology with sensitive skin. I think you just have to understand what type of sensitivity that you're dealing with. So some people are sensitive to different types of products. Some people are not really experiencing sensitive skin, but they have intolerant skin because they haven't done anything but use a Dove bar on it for their entire existence, right? So it's a matter of really understanding what that sensitivity is. Is it a matter of they have more of a propensity to erythema after with really light protocols or what you're treating? So I don't think that there's necessarily like if you have sensitive skin, then you can't be treated with laser dermatology. It's just a matter of how we're going to treat you, if that
Hmm.
makes sense. Yeah.
Got it. Okay. Now, I want to dive deeper into something that you guys have, which is the precise Pico laser pigmentation protocols. What
Yes.
is that?
Oh God. They're really extensive. So, when we first started working with Pico technology, we started working with just tattoo removal. That was our number one thing for that device. And that's really kind of where we kind of left it at. We were like, it's for a tattoo. And that's what we treated it with. And then, like I said, the number one thing that people kept coming to us with was hyperpigmentation, hyperpigmentation, hyperpigmentation. And a long time ago, we would use, resurfacing. We would use chemical peels to do that. We would use erbium lasers to do that. And then I started thinking, hey, no one has downtime for this. No one has downtime to be, 7 to 10 days, sometimes 3 weeks with any type of like resurfacing device. And so we started using our Pico to play around with pigmentation to see, how can we move this specifically on darker skin tones where we don't want to remove their natural melanin, but we're going after the melanin that they don't want to see, right? So that took a long time for us to figure out exactly what those protocols would be to be safe and ethical on darker skin types. And I mean three through six.
Mhm. Okay. And so and for those darker skin types, you mentioned like you need to be very careful about removing the right pigmentation that you really want to
Absolutely.
remove. So for people that have darker skin, what do they
Mhm.
have to keep in mind when it comes to any type of laser treatment that they have to be more careful of?
Yeah, absolutely. I think number one is going to a provider who understands multiple skin types. understanding the technology that they're going to be using. I know, a big thing in the industry right now is everybody goes, if it's dark skin, it has to be a yak, and that's just not true.
Mm. Mhm.
If it's dark skin, it just has to have a different protocol with whatever device that you're using. Obviously, there are certain devices that are absolutely a no-no, like IPL. But as far as lasers are concerned, if you understand laser physics and you understand the protocols in which to use them and the realms in which to use them on darker skin types, they are candidates for multiple different treatments. I think a big part of a responsibility that I hold in the market is being able to educate and make sure that we have proper education on lasers, whether you're if it's one or through six, so that people can understand that laser technology is for everyone. It's just a matter of making sure that you're going to the correct provider who understands the technology.
Okay. So in what situation would someone come to you? Like, is it a certain something that as obviously with the skin, but like in what
Yeah.
situations would they come and see you? Like, if they did have acne, would they come and see you? Like, are there certain situations, like if they have a sunburn, would they come and see? Like, in what situations would people want to
Oh
come and see?
wow, I see so many different cases every day, Daniel. So basically I put it underneath the umbrella. If it's skin, we treat it. But
Mm,
like I said, number one is always pigmentation, melasma. Those are our top conditions. Acne, rosacea, scars are number one thing as
mm,
well. So if you're dealing with any type of like injury to the dermis where you're left with a scar, or if you're dealing with acne scars, that's a big one of our treatments as well.
mm.
Um, I could go on and on. Resurfacing, anti-aging, tightening skin, you kind of name it. Yeah, anything you could think of, cysts.
Oh, okay.
Yeah, anything skin related is kind
Mhm.
of like where we live, and practicing laser and cosmetic dermatology is kind of like a niche for us. These, like I said, these devices aren't cheap, so you're not going to find some of the amazing technology that we have here at PSRX in most places.
Okay. And so you can do scar removal as well.
Yes,
Okay.
absolutely.
So scar removal, is that something kind of the same with the tattoo removal? You can, with enough sessions, you can completely get rid of it, or it's just more like a blending in.
Depending on what type of scar. So there's
Mm,
so many different types of scars. And so I get that blanket question a lot. Like, can you remove this scar? And I'm like, I need to know how it was caused and how deep it goes. And is it just pigmentation, or am I dealing with hypertrophic? Am I dealing with a keloid? So all those different parameters come into place with the scar. And there are so many different ways to treat each one. I always tell people to have realistic expectations when it comes to scars, because if you think about it, like let's just take, for instance, a hypertrophic scar where we actually have a complete remodeling of skin.
mm,
For me to completely remodel it back to the way that it was, it's probably not going to be exactly how it was before. However, you'll see a nice improvement. So I always set those realistic expectations in my practice with patients. And then ask them, is this a realistic expectation that you'll be comfortable with if that's the end result? And that's kind of lets them know whether it's something that they can live with or something that they want to tackle.
got it. Okay. Now, I know we talked a lot about skin and all the different types of conditions and situations, but what would you say are some of the most common misconceptions that you hear? I think we talked about a few of those already, but what
Yeah.
are some other common misconceptions you hear the most?
Most common things that I think are concerned with like tattoo removal and pigmentation is that people think that things are one and done,
Hmm.
where actually that's like years of work to be able to get you a nice result. And so, one of the biggest misconceptions that I'm dealing with right now, I think over the years, people have learned that tattoo removal takes more than one treatment. So that has kind of died down as the
Hmm.
time has gone on. But a misconception is now the chemical peels remove pigmentation after one treatment.
Hmm.
And so I'm noticing a lot of in my skin consultations that I'm having to explain the difference between suppressing a melanocyte and ridding a melanocyte. So a lot of medications as well as chemical peels and treatments will suppress your melanocyte, right? So it pushes it down, stops it from kind of creating any more to come to the surface. But the minute that you stop that mechanism of how you're treating it, then it comes up to the surface.
Hmm.
Whereas when we're dealing with Pico laser, Picos actually obliterate pigmentation. So that is a permanent result. So having
Um,
to have those conversations is a big misnomer in the industry.
Oh, interesting. Some of the treatments is just temporary and others are permanent.
Absolutely.
Interesting. I never knew that one. Okay. So let's say that someone is looking to get some type of treatment done, and they're looking for a provider. They're not quite sure who to go to. They don't even know where to start. Where would you advise them to start, and what to keep an eye out for as they're doing their search?
Yeah. So when it comes to laser dermatology, I would ask what type of technology that they have in their office. A big red flag for me is that when people ask for a certain type of tech or brand name of tech. So brand names are scary because if somebody carries a brand name, it's not necessarily meaning that they're carrying the technology that's best for your skin. So learning to ask those questions, like what type of tech is this? How long has it been in the market? How does it treat my skin type? What are the pre and post instructions that you can give me for somebody who has a darker skin tone or my skin tone, whatever that may be, or has had my condition? Asking what type of certifications that they have, as well as in laser, or were they just trained by the company of the laser, seeing if they furthered their education in that. So there's so many different questions that you can ask, but I would just really look out for if they have existing patients that look like you, that have conditions like you, that has skin that looks like yours. All those things are really important to be able to know if you're in the right hands.
Okay. And how do you approach educating your clients and your patients on the benefits of these treatments? I know we talked about a lot of it already, but again, I'm
Yeah,
sure you get a lot of people coming in and they just have these different misconceptions or they think they need something when
absolutely.
really they need something else. So how do you push that educational component?
Yeah, so a big part of PSRX is that we lead with education. So when you come into our practice, there is no, you come into a treatment room. That never happens. When a patient comes into our practice for the first time, we have just a one-on-one conversation in our consultative office. We look at their skin, we educate them on what protocols are going to be best for them, how long they can expect to be treating that different skin condition, and then setting those realistic expectations. So from the very beginning of walking into our office, education is already the forefront of everything that we do.
Okay. And what role do you believe creativity plays in how you approach your patient care?
Yeah. I think a big reason of why my career has gone the way it has is that I'm not scared to practice medicine. I think that especially in aesthetic medicine, we've gotten away from practicing true medicine. And the leaders and the people who have made strides in medicine altogether, not just aesthetic medicine, are the ones who kind of push boundaries and saw like, can this work? Does this work? Will this work a little bit better? And having that type of approach to everything is always going to catapult you to be able to make the best protocols in the market for your patients.
Okay. So, and throughout your experience, Ronnie, I'm sure that you've had some tough cases or memorable cases that come to mind. Is there maybe one story that you can share of just very memorable, maybe challenging case and how you were able to get them a successful outcome in the end?
Yeah. I think I have a lot of a lot of challenging cases.
Yeah.
And I think that's just because I deal with skin, the largest organ of the body, and not every time that you think that something is the way that the protocol should go and this is how it's going to work, you get that one patient who's the exception to the rule, right?
Mm-hmm.
And so I have had experiences of treating a patient who was struggling with scars, hypertrophic scars. They were hyperpigmented scars on her legs, and everything that I did just did not work. Everything I did not work. And what ended up happening is that I put her on a small dose of hydroquinone for 3 months, had her treat with tranexamic acid, and then come back to me in 6 months. And that is the only thing that treated her well. So it
Huh.
was more so me pivoting her from doing clinical treatments to starting with at-home skincare to be able to lighten these scars up. But when I tell you, I went after that thing with everything. Like I did Pico laser, I did erbium, I did microneedling, I did microcoring, I did everything you could possibly think of for those scars, and they were just not budging. If anything, they would have moments where they would get better, then get worse, then get better, then get worse, and I was just done. So I had to take a moment to step back and say, let's just go back to like simple dermatology and
Mm.
see what happens. So
Okay. Sometimes it's the answer
sometimes
that
it
you never
just
thought.
isn't. Yeah. And you have to give yourself that grace to know that like you're practicing medicine and what works for one person necessarily doesn't work for the other. And
Mhm.
I've really learned over my years in my career that I have to give myself grace when something just doesn't go the way that I think it will.
Mhm. And I'm glad you bring up that point because I want to get your thoughts on, because I'm sure on the other end of that, you have patients who uh, maybe you're their last stop. It's like they've tried everything.
Yeah.
They've tried all these products, they've gone to the doctor, they've gone to multiple doctors, and just nothing works. And you're kind of like the last stop. It's like, hey, if you
Yeah.
can't do this, then I'm just giving up.
Yeah.
So, what type of message do you give to people who are in situations like that where they tried everything, nothing's working, and they feel like there's no solution for them?
Sometimes there isn't a solution. Like,
Mm,
I'm definitely a misfit. I'm definitely going to try things that probably other providers haven't tried before. Um, but sometimes I have to be the last one that they have that real conversation with of like, this is something that we're going to have to live with.
mm.
And it's not the coolest position to be in, to be that last stop where
Yeah.
you have to have that realistic conversation. But I think it's important to take ownership of that and really understand that sometimes somebody just needs a moment where they just have a need a knee with you. And it's like, this is what's going on.
Mm,
This is what it is. Now, how can we manage this? How can we manage your mental health with what's going on? So sometimes it is just kind of like there's no answer,
mm.
at least right now. Medicine is always changing.
Yeah.
And things do change over the years. And
Mm,
I even had patients where I've treated them and then been like, it's like 3 years later, and I still think about that patient, and I'm like, I've come up with something else.
yeah.
Like, I just need them back again. But, sometimes it just takes time to catch up with what you're looking for.
Yeah. Okay. Now, Vonnie, where do you think the future of aesthetics and dermatology is going?
Yeah, I've been hearing a whole lot about where everybody thinks it's going.
Yeah.
And I've been hearing a lot of regenerative medicine.
Mm,
People think that people are going away from fillers and tox and all of these things. And I don't really have that answer. I think that our patients are going to start demanding things, and that kind of dictates how the market gets penetrated and how it rolls. And I think what patients had started doing is wanting other alternatives besides filling my face with filler and toxing me up. And so what you started to see in the market now is you see a lot of like PDRN and different uses of PRP and all of those things are kind of like shifting us to kind of use other modalities to be able to make like these I don't know, these changes to skin.
mhm,
But I don't think that anything's going away. I think it's just going to be a matter of like what's most in trend now.
mm,
Because remember, they said that, and then now you see this influx of people who want facial balancing.
mhm,
So you just never really know. Like this market's so funny. I think the major thing that I can give advice to anybody in this market is just focus on the patients in front of you. Your
mm.
market is going to be different than anybody else's. Don't pay attention to a bunch of noise. Just kind of focus on your practice and what your patients are seeking. And then that's going to be the way to make sure that you're going in the right direction for future.
Okay. And with that in mind, also, what's your vision for your practice, PSRX?
Yeah, I have a big one. Um,
Let's hear it.
So when I first started PSRX, I envisioned us with like 90 locations.
Mm,
However,
mhm.
that has changed. After doing three, I'm like, I don't see 90. I don't think that's the direction at all.
Yeah.
But I do see us becoming more facing to patients on a retail base. So where I
Mhm,
see PSRX going is growing our medical grade skincare line, Precise MD Skin Health, into major retailers, as well as putting it in the forefront as far as like a flagship retail store where you can come in, have your skin analyzed, and actually come up with skincare routines that fit best for you, as opposed to just sitting on a shelf. But being, I guess what you could say would be like Precise MD Skin Health meets the Apple Store.
mm,
And so that's what I see our clinic being, and then having those clinical protocols with laser attached to it. But yeah, I see it going in that direction and continuing to develop technology through our tech company, Precise Aesthetics. Trevello has some new things coming up on the map as far as technology is concerned. So to continue pushing the buttons on what's right, what's wrong, what works, what doesn't.
well, it's a wonderful vision.
Yeah.
Okay, well, Ronnie, I have one last question for you, but before I ask it, I want to point people to your website at psrxbodyandskin.com.
Absolutely.
Now, last question is, what does beauty mean to you?
Oh, really gonna get me off course there, huh? So in all of my years of practicing, I would say that beauty has changed for me. When I first started, I thought it was like the proper, the perfect skin, the perfect lips, the perfect cheeks, the perfect jawline structure. And now I really think that beauty has a deeper meaning in the sense of like where you feel most confident and most yourself. If there is something that is bothering a patient to the point where they become, like they just can't function, then I say they haven't reached what their true beauty is. So, beauty to me is just about encompassing who you are, and being confident in the skin that you're in.
Awesome. Well, there you have it. Ronnie sharing your expertise. So, Ronnie, where can people contact you in your practice?
Absolutely. So you can reach us at our website at www.psrxbodyandskin.com, or you can give us a call at 877-622-PSRX.
Awesome. Well, Ronnie, this is awesome. Thank you for coming on. Thank you for sharing your knowledge, and thank you for sharing your message.
Thank you. Appreciate you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.
So in all of my years of practicing, I would say that beauty has changed for me. When I first started, I thought it was like the proper, the perfect skin, the perfect lips, the perfect cheeks, the perfect jawline structure. And now I really think that beauty has a deeper meaning in the sense of like where you feel most confident and most yourself.